Staying healthy starts with you, but sometimes you need a partner to keep you on track. Mainline Health welcomes you to this edition of Healthy You, Young Women's Hearts at Increased Risk.
Hello, everyone, and thank you for joining us on today's webinar, Young Women's Hearts at Increased Risk. We are brought to you today by NBC10.com and the Lankenau Heart Institute. My name is Pat Shiraki. I'm your host today. With me are these three fabulous women. Dr. Kate Hawthorne, a non-invasive cardiologist at Lankenau Heart Institute. Heather Forgione, the Women's Heart Initiative Program Manager, who will be explaining what is available at the Heart Institute. And then our patient, Zakia Morrison, a young mother from our area who had a heart attack while she was pregnant. She'll share her personal heart health journey during our discussion. And thank you all so much for being here. Now, before we begin, let's review the icons at the bottom of your screen. They're going to help you participate today. If you have any questions during the webinar, you can click onto the Q&A icon at the bottom and submit your question. We're going to try to answer these during this webcast, but if a fuller answer is needed, it may be answered later on. And to learn more about that and our health expert who will be answering those questions, you can see his bio displayed. Additional materials and information are also available in the resource list icon. That looks like a folder. It's at the bottom of your screen. If you have any technical difficulty, please click on the help icon. It has a question mark icon and it covers common technical issues. We encourage you also to share your involvement on social media by clicking the social share icon. Finally, you can reach out to the Lankenau Heart Institute to make an appointment by clicking on the Lankenau Heart Institute icon. An on-demand version of this webcast will be available early next week and can be accessed using the same audience link that was sent to you earlier. It can also be found on NBC10.com/healthyu. Now, let me explain a little bit more about our Dr. Hawthorne, who's with us today. She is a non-invasive cardiologist with a specialty in advanced imaging. She studied locally, graduating from Jefferson Medical College. Dr. Hawthorne is with the Lankenau Heart Institute and works with the Women's Heart Initiative. And you're going to be learning so much more about that today. Dr. Hawthorne, thank you so much.
Thank you for having us.
So tell us more about what it is that drew you into cardiac medicine in particular.
So I think the major reason I went into cardiology is because it's a field within medicine that's constantly advancing. There's so much we can do now to help our patients live better, longer quality lives. On a personal side, my family has kind of always been taught about heart disease. My grandfather was a Philadelphia police officer and actually died in the line of duty at the age of 40 while in pursuit of a criminal. So it's something that's always been in my life, heart disease, and in the background.
And so you also seem to have a very special interest in women's heart health.
Yes, partially I think because I'm a woman, so naturally started to gravitate towards that area, but there's really a huge disparity in women's heart health. And so with the disparities that we see, it's something that I strive to work for every day.
Okay, so let's begin with explaining to everyone about cardiovascular disease, particularly in women. What do we need to know?
So I think the first thing to know is just that all women are at risk. So unfortunately, only about 45% of women even think that heart health is something they have to be aware of. But we know that heart disease is the leading cause of death for women. So 1 in 3 women who die this year will die of cardiovascular disease. So that's a huge number, bigger than the next 4 causes of death combined, higher than all cancer combined. So it's a huge issue for women. So first is just acknowledging that we are at risk.
And so what are the complications, though, for women in particular?
So there's so many unique aspects for women between the risk factors, which we'll get to in a minute, the complications because women tend to present later. Women are also undertreated. We're less likely to receive goal-directed therapies that we know can improve outcomes. We're less likely to be prescribed lipid-lowering therapy, as an example. So many of the medications we know can prevent disease.
Yeah, so to explain to everybody, lipid-lowering therapies, it would be the fats in your blood taking medication to be able to lower the fats in your blood.
Exactly. So cholesterol medicines, things like that.
Okay, so typically, when you talk about heart disease, you think of somebody who is older, you think of somebody who is primarily male, okay? You typically would be a disease of men. That's a myth, though.
Huge myth.
Okay, so let's talk.
Myth.
Let's dispel some of these myths.
So one of the biggest myths within women's heart health is that heart disease is of old white men, and that's just not the case. And actually, what we've seen over the past several decades, as cardiology has advanced, we're doing really well. The survival rates for that, those older white men has been fabulous, but women are lagging behind. And something that's really startling is that we see the rates of heart attacks in young women is on the rise. So in a study that looked at 10 years, they found that 30% of patients who came in with heart attacks were young women. So women under the age of 54, between 30 to 54. So we're seeing the rate of heart attacks increase in that age group. And we're also seeing that age group has a higher mortality rate than we expect for anyone else coming in with a heart attack.
And so they're dying.
Yeah, at a higher rate compared to other groups of patients.
And so why is it that these younger women are presenting with all of these symptoms and they're having heart attacks and they're dying? What is the complicating factor that makes that so evident?
So I think it's a lot of things together. I think one, as patients, we are reluctant to think that we're having a heart event. So a young woman doesn't see herself as a heart patient. We again go back to that older white man. So we are later to present, later to even acknowledge that we're having symptoms. Even my own mother, I'm talking to her, didn't even tell me about her symptoms for 6 months until she was having them. So
wait a minute, and you're a cardiologist.
And I'm a cardiologist. How bad is that going to look, Mom?
Right, exactly.
So we're reluctant. We wipe things out. I've got to take the kids to soccer practice. I got to take, my mom to do this. I have other things to do. I can't worry about myself. Nothing's going on. It's just some indigestion.
Right.
And even women who come to my office to see me have a hard time calling it chest pain. They'll often do this. They call it discomfort, pressure. Pain is something, women are a little bit strong-willed. We know what pain is, and right. You do this, but don't want to call it pain.
It must be the giving birth thing.
I think so. Right, something about women.
All right, so let's look at some of the risk factors that are involved as well, specifically for women.
So,
what are they?
So of course we have to think about the regular risk factors for all of our patients. So age, high blood pressure, diabetes, high cholesterol, smoking, family history, which is an important one because it's surprising how many people don't really know their family history, and it's a very important part of your own history. And then we think about women. There are several unique risk factors that all women should be aware of, and one of them are complications of pregnancy, which I think we're going to come back to later. Yeah. But there's a whole spectrum of complications in pregnancy that we see in young women that we know leads to increased risk down the line. So that's a huge one. Another one, early menopause. So women who go through menopause at a younger age, less than 55 years old, have an increased risk. All kinds of therapies we now have for cancer treatments, particularly breast cancer, can have an impact on heart health. So those are some big ones that we don't think about. There's also autoimmune diseases, inflammatory diseases. So there's really a whole spectrum of things outside of those things we think about.
Exactly, because you immediately think about smoking. You think about obesity. You think about high cholesterol and family history. You think of those right off the top. The thing I find really interesting is that heart disease is the #1 killer of women. I mean, that's a stunning statistic.
But only 45% of women acknowledge that. So the American Heart Association has really done a lot over the past several years to increase that because the numbers were even lower. But since 2006, we've kind of hit a plateau, and only about 45% of women acknowledge that they're at risk for heart disease. And that is even worse with our minority women who tend to have poorer outcomes. But as an example, only 25% of African American women acknowledge that heart disease is their highest risk.
All right. So we want to talk also about some of the symptoms that are involved. And Zakia is going to explain to us also in just a moment, Zakia, what you experienced, because you were thinking it was just indigestion. So let's give everybody a bit of a primer. What would be the symptoms of a heart attack?
So even though we talk about women and men having different symptoms, 87% of women are still going to come to the table with chest pain. They're still going to present with chest pain. But it's the way they describe it. As I mentioned, a lot of my patients have a hard time using the word pain. They describe it in a different way. Heartburn is a very common way people perceive that discomfort. pressure, something sitting on my chest, tightness. But women are also more likely to have the associated symptoms like shortness of breath, nausea, sweating, pain in the belly. So some things that maybe might make us as providers think about other things. You know, if you tell me you're having heartburn and pain in your belly, I am going to think maybe you're having reflux, but those symptoms can be the same.
All right, so Zakia,
Yeah.
you were 36 years old a couple of years ago. You were pregnant with your daughter.
Yeah, so I
And what
remember it like it
happened?
was yesterday. I was 36. I was working full-time as a school nurse. I also had a background as being a postpartum nurse for 6 years. So I was pretty, not nifty, but knowledgeable about different OB symptoms and pregnancy.
Right.
So I noticed as I would drive to work, I would get little chest pains. And by the time I would get out the car and walk up the steps to go into the building, it felt like heartburn. So I was wondering, like, am I doing too much? I was taking it easy at work. I had a lot of help. I wasn't by myself in the nursing office or anything. But it lasted for about a week, the on and off symptoms. It was chest pain, the heartburn, the indigestion. I was exhausted. I just would walk one length of a hallway and I would have to sit down and catch my breath. As long as I
mean, it's
sat
highly
still,
unusual.
Right.
Right.
But as long as I sat still and stopped moving, the symptoms would stop. If I stood up and started walking and trying to do any work, that's when the symptoms would come on.
Okay, so, and again, as a younger woman, I mean, this had to be surprising to you. And so, Doctor, I go back to you for the question of why is it that younger women are having this issue?
Having more heart attacks?
Yeah,
you
more
mean?
heart attacks, yeah.
So a lot of it, again, is probably more complicated. One is we're, as a society, having a much higher rate of obesity. We've seen those, numbers from the CDC just climb over the past several years. So with that, we're seeing higher rates of hypertension, high blood pressure, high cholesterol, and diabetes. And we actually know that many patients who are presenting with their first heart attack, who are young, so again, in that 30 to 50 range, do have some of these other risk factors that either weren't recognized because many 30 to 40-year-olds don't go to the doctor regularly, were not treated at all even though they were known, or were undertreated.
Okay, so when we look at some of these risk factors, and so we go back to if you have a higher cholesterol, if you are overweight, if you have a family history, they're risk factors that you just can't collapse into. You have to be able to modify some of those risk factors.
Absolutely.
Right? And so how do you begin to do that?
So lifestyle is probably what I talk about the most on a day-to-day basis. And there's so much that we can do with a healthy lifestyle. And actually, we know that women who follow a healthy lifestyle can decrease their chance of having a heart attack and stroke by up to 80%. So just living a lifestyle, so that's outside of your family history and things that come through your genes. So what does that mean? Well, it means a lot of things that maybe aren't always the easiest. One is being active. So I cannot preach enough how bad a sedentary lifestyle is for you, and it's actually one of the risk factors I should have talked about. So, I talk to my patients about sedentary lifestyle like it's the new smoking. So patients who aren't exercising, it's just as bad as if you're a smoker.
I mean, that's a big statement, I think. Yeah, go ahead.
But
No,
it's
I'm sorry, I
true.
interrupted you. Go ahead.
But it's totally true. So we know that if you are active, even if you don't lose any weight, but you are active, you are less likely to have a heart event. So getting out there, exercising, trying to get that 150 minutes of activity per week can make a big difference. And then not drinking alcohol, using alcohol in moderation, not smoking, of course. I think all of us know that smoking is bad for us. Watching how you eat. So as Americans, we don't follow the healthiest diet. The diets that are the best are certainly controversial at times. But what we know is tried and true and what has been shown to be helpful is more of a Mediterranean style, lots of fresh vegetables, fruits, lean proteins, whole grains.
And that's really something that you can start early.
Absolutely. And that's where it really comes into thinking about things early, and as a young woman taking charge of your heart health, because making those changes early is going to have nothing but huge benefit down the road.
Okay, so here we had Zakia being pregnant, and that is not an unusual thing from what the research is showing, that there are a lot of pregnant women who can be at a higher risk for heart attack. Explain why that is the case.
So unfortunately,
and what happens with them?
So unfortunately, we're seeing a rise in heart attacks in pregnant women, either during pregnancy or within the first couple of months postpartum. And that figure is estimated to be increased by about 25%. So 25% higher rate of having a heart attack during pregnancy. And why is that? Again, Americans are coming into pregnancy at older age. We're establishing
That's
our careers first,
right?
so that makes it a little bit harder, speaking as an older lady. So coming into pregnancy a little bit older, also with more comorbidities. So we're seeing higher rates of women who are coming into pregnancy already being diagnosed with high blood pressure and diabetes and obesity, all things that are going to increase your risk of having a heart attack. So there's that piece. And then there's actually a couple other important aspects. So one is we now are much better at recognizing something called spontaneous coronary artery dissection, also called SCAD. So SCAD is a tear in the artery itself, and it's actually the highest cause of heart attacks during pregnancy. Not the case for Zakia, but something that we are seeing. And it was previously thought to be something rare, but the more we learn about it through some great advocates, the more we're recognizing it. So we're better at recognizing different types of heart attacks as opposed to just the standard type of heart attack.
Can you know in advance if you're at risk for SCAD?
Unfortunately not. Wow. So it's something that we see. It's not common during pregnancy, but during pregnancy when we see a heart attack, it is the most common cause.
Okay, so not the case again with Zakia. So, but with your situation, Zakia, you had these different symptoms, and you had said that you were extremely tired. How did you know and recognize that, gee, this really might be a heart attack, and I better get some attention?
Well, I didn't think it was a heart attack, like Dr. Hawthorne
You did not.
said. Would not have crossed my mind. Yeah. I really did think it was indigestion. I've been type 1 diabetic since I was 6 years old. So I had multiple doctor appointments already lined up with the endocrine doctor, my OB doctor, the primary doctor, you name it, I was there. So I was running, everything was smoothly. I didn't have any nausea or any symptoms for the first 5 months of the pregnancy. And then bam, out the blue was the chest pain. There were no symptoms that led or, it's slowly getting worse. It was just like chest pain, heartburn. And it was so out the blue. So I tried different over-the-counter meds, didn't work. So I decided to go to the ER. I said, let me go, have my labs checked. In the ER, my labs were okay.
First
that
round.
day.
That day.
That day they were okay.
Because just to explain to everybody, they look for a particular enzyme to see if there is damage to the heart muscle. Is that correct?
True. Something called a troponin.
Okay. So
it was negative that day.
It was okay that day, right?
EKG was normal that day. So they gave me IV fluids, and I basically said, okay, maybe I am doing too much. I remember back in college, I would have anxiety attacks if there was a final coming up. So I thought maybe I just need to take it easy. But I went back to work, and while I was at work, I was really exhausted. It went from not being able to walk the length of the hallway to I would maybe go up 2 steps, and then I would sit down and be like, I have to catch my breath. It was unreal, the symptoms.
And it wasn't in the end stage of your pregnancy. It was, halfway through.
And I knew, I was like, there's no way that people would want to have multiple pregnancies if they're feeling the way I feel right now. That's all I kept thinking in my head, this is not right. And okay, we have the labs and we have the tests that said everything was okay, but it was something about women's intuition, because I said, I'm going to have to go back to the ER. And I waited a couple of days. I was trying the different meds that I was prescribed, and the different meds over the counter. And I was calling the OB doctor every day saying, okay, this med isn't working. Can we try something else? Mm-hmm. And when I came to the point where I was like, I couldn't sit down, lay down. I couldn't move to the side. Nothing helped. I was so uncomfortable with the heartburn. Mm-hmm. So I went back to the ER. And it's funny, I had a little different stresses going on. I was in the middle of selling a house. So I told my my fiance, I said, go take the trash out. I'm gonna go get my labs checked real quick at the ER. I'm just thinking this in my head. And they did the EKG in the triage room, but this time everybody's looking at me, and I'm sitting there eating an apple, why is everybody staring at me? It didn't dawn on me that it was that serious. And yeah, I remember they told me, we need you to sit in a wheelchair, and they took me into a room, and then everybody's coming to run tests. And I was like, that's when they broke it to me that I had a heart attack. So I don't know exactly when I had the heart attack, because I was going through those symptoms for, days in a row.
Right. Okay, so here's a beautiful picture. Is this your little girl here?
Oh, that's me at work.
That's you at work. Okay, all right.
It was your daughter that was on the image
a little
before
bit
that.
earlier. Okay, so that's you doing your thing
That's baby Zaya.
So so we look at all of that, and Dr. Hawthorne, when you hear that, you also have to be clicking through in your mind what some of the other complications can be in pregnancy that can really put women at risk for additional stress on their heart as well as other organs in their body.
So a lot of us think about pregnancy as a stress test. So there's a lot that happens on the physiologic standpoint to a woman during pregnancy, and sometimes we see this kind of thing happen, and it didn't sound like Zakia was having any symptoms before that point, so there was no reason to suspect. But as she told her story, there were a lot of big red flags. You don't have heartburn on exertion is not normal. So a lot of us describe things as heartburn. Heartburn when you walk is not normal heartburn. And then the shortness of breath that she was having with it. And it gets complicated during pregnancy because a lot of pregnant women are short of breath and have heartburn. So sometimes it really takes talking to a couple of doctors to figure out what's going on.
Yeah, and so let's also talk about a couple of other problems that seem to develop during pregnancy. I mean, one that we've heard about is preeclampsia. So what is that?
So preeclampsia is an abnormality within the placenta that kind of causes a whole system issue. So the way it manifests itself is with high blood pressure and something else that's telling us that the body's in danger, basically. So we can see protein in the urine telling us the kidneys are unhappy, headaches, blurred vision, abdominal pain, chest pain. So it really can manifest itself in different ways, but high blood pressure is one of the hallmarks.
Okay, and then there's also a gestational diabetes. And so that's different than the diabetes that Zakia was dealing with.
Yeah, so Zakia is a type 1. This is a childhood diabetes. It's an insufficiency from an autoimmune standpoint in the pancreas. So totally different entity from the type 2 diabetes that we think about in older adults. So there's a whole spectrum of complications during pregnancy that are important to bring up. So gestational diabetes is having abnormal blood sugar during pregnancy. So tends to go away after delivery, but is a major risk factor for developing diabetes down the road, type 2 diabetes.
No kidding. I mean, somebody may not have diabetes at all. They become pregnant, they develop gestational diabetes, and then that essentially sets them up for type 2.
Exactly.
Later
So
in
we
life.
see the rates of diabetes in women who have that history are much, much higher when you compare them to women who do not have that history. Right. And then the realm of hypertensive complications. So you can have gestational hypertension, developing high blood pressure during pregnancy. You can have preeclampsia, eclampsia. There's really a whole spectrum of disease process. And really the bottom line for me with these pregnancy complications, I mean, we have amazing OBs who handle these complications during pregnancy, but after delivery, one of the most important aspects to remember is that these complications don't go away after delivery. And that's something that historically we've always thought, preeclampsia is cured by delivery of the baby. But I am really trying to educate my patients in that this is now a part of your history. So women who have a history of preeclampsia have a much higher risk of developing hypertension, 4-fold, and cardiovascular disease, meaning heart attacks and strokes, up to 2-fold. Wow. And if you add in severe preeclampsia with preterm delivery, so babies who come before 37 weeks, that risk goes up to 8-fold. So we're talking a huge risk factor for cardiovascular disease that we're seeing in young women. So the way that I treat those women is this is an early life manifestation of increased risk. And now for the next several decades.
Right, exactly. The next 70 years of your life.
The next 70 years, we have to, all that modifiable stuff we talked about earlier, we've got to really get on that and make sure you're living the best life you can, and I'm controlling your blood pressure and cholesterol and everything we can, because you have shown us that your body had failed that stress test, basically, and you have an increased risk.
Yeah, so this I found in preparation for today's webinar. There was something that I had read in the prep that really disturbed me, and that's about the mortality rate of women in Philadelphia being so high. Can you speak to that for us?
Yeah.
I found the statistic shocking.
So over the past couple of years, we've kind of seen a lot come out on the maternal mortality rates in the United States, which are much higher than other developed countries. It's really kind of sad. And in Philadelphia, our rates are actually 50% higher than the national average. So a number that's already too high, we are now 50% above that.
So that's 50% more women who have been giving birth are dying
In Philadelphia
than the national average.
Exactly.
I mean, that's a lot.
And what we see when we look at the data that came out of the Philadelphia Department of Health is that many of these women are dying from cardiovascular disease, so complications after delivery, cardiomyopathy, blood pressure, heart attacks, strokes, so many things, and a large portion of those are preventable. So it's really something that we've been teaming up with our obstetric colleagues to try to combat.
So let's talk about also some of the breakthroughs for the future.
So there's been a lot on the news lately about Mick Jagger having his TAVR. So there's a lot in cardiology that we can now do with minimally invasive incisions or through catheters. And Lankenau Heart Group is an amazing resource. We have access to all the latest technology, can do surgeries through tiny incisions now that used to require large sternotomies. So we have a really great team that can handle all of the things that we can do basically on a smaller scale. And hopefully as we move forward, we start to see more breakthroughs in prevention.
Yeah, and I would say that when you say that really is the key thing for what we can do to help women in the future?
Mm-hmm. Absolutely.
Prevention.
There's so much we can do once you have cardiovascular disease, but I don't want to get to that point. I want to meet you before you have the event and treat those things. Now again, this was a crazy scenario, but I want to take those women, say who have those complications of pregnancy, make sure they're aware of their risk, they are doing all that they can, and we're working together to reduce their risk.
And so in this personal journey, Zakia, you actually have come forward because you have some advice for other women. I mean, what
Right.
Tell me about that.
I mean, so my goal is to get the word out and make sure women are aware of what their vitals are, with their blood pressure and their labs, with their cholesterol. I want them to know what their numbers are in case they do need to go to the ER, so there is a comparison. Luckily, in the system with Mainline Health, they were able to pull up and say, okay, she did have an EKG not too long ago and it was normal compared to what we just, had done that day. So women should get out there and know what their numbers are, basically.
Okay, and your experience with being with Mainline Health and through the Heart Institute was really helpful to you.
Yes. So me and Dr. Hawthorne, I never forget, she came to the room because I had to go to the operating room, from the ER to have a stent placed, and they went through the calf, through my wrist. But I never forget, she said, we're going to be best friends for the rest of this pregnancy.
We saw each other a lot during her pregnancy.
I bet.
That baby's half mine.
So you actually had to have a stent in order to open up your artery.
Yes, my LAD, left anterior descending artery, was
which is
100% closed.
Wow.
A major artery that supplies the blood
to your whole body.
Half of my body was 100% closed.
Wow.
Yes,
I mean, she was really at high risk.
Oh, absolutely.
Yeah,
I mean,
massive.
she had a massive heart attack during her pregnancy.
Wow. Okay, so as we have, Heather, you've been so patient.
Oh no, her story is so amazing.
And so, as the program director for the Women's Heart Initiative, when you listen to this story with what Zakia said, I mean, Zakia's not alone in this.
She's not.
So, tell me about the mission of the Women's Heart Initiative.
So, the Women's Heart Initiative is a dedicated program to bring awareness and education around heart disease and the risk factors around it. So we do a lot of education in the community. Zakia is one of our ambassadors.
I can see why.
Yes, her story has really brought a lot of awareness to younger women and pregnant women of how important it is to really understand the risk factors, as Dr. Hawthorne talked about earlier. So our goal is really to educate women in the community have them learn about their risk factors, and also, have them act. We have a saying, learn, act, live. Have them act on it by going to screenings and also getting that awareness out to their family and friends. And then through that shared learning, that they live heart healthier lives.
And so what kind of education programs are you developing?
So we have a lot of educational programs that we do. We have cardiologists that go out into the community and do educational seminars. We host a lot of educational events in the community where women can come and talk to cardiologists and nurses about heart disease, about the minimally invasive procedures, new medical devices, and also learn about more clinical trials that are going on at Mainline Health.
And so give us a little bit more too about some of the resources that are available.
So we're very lucky because we in the Philadelphia region have a lot of female cardiologists, and the Women's Heart Initiative works very closely with these female cardiologists that have created resources like a brochure that I believe will be on on our website. It's Women's Guide to Protect Her Heart, and it talks about all the unique new trending risk factors for heart disease, and it really brings like a call to action. It's kind of like a great story read. They also had developed a risk assessment tool specific to women. So what we're really trying to do is get women to take this cardiac risk, because not many primary physicians talk about heart health during their physical exam. So we're really trying to get the word out. Another thing that we do is heart-to-heart conversations, where Zakia is part of. It's a support group for women who've had a cardiac event, but also for those women who are at high risk. And it really talks about the emotional piece, because it's really, I'm sure you can say that emotionally it's been a journey.
Yeah,
Yes.
I mean, Zakia was telling us a little bit earlier that she tears up when she thinks about her little girl. Right.
Yeah. Try to hold
She's
it
been trying to get her.
So when Zaya turned 1, I had so much support with my family and my friends, but I still kind of felt alone at the same time. So when she was 1 year old, I said, okay, she's able to communicate what she wants if I'm not around. So I felt like I should step out and, join the support group. And it was one of the best decisions ever, because before I didn't even want to acknowledge what happened to me, because I felt like acknowledging it meant I had to relive it over and over again. Yeah. So now I'm getting teary-eyed.
Well, I mean, true, because you find, your little girl potentially was at risk, your life was at risk,
right.
And then you start thinking about all these scenarios.
Exactly.
Yeah, and how's life going to be able to continue?
Right.
And so Heather, what are you actually encouraging women to do? Are you talking about them really kind of taking control of their
Absolutely.
heart?
So we encourage women, first and foremost, know your risks. Take your risk assessment tool. Know them. If you score 4 or more, you really need to talk to your doctor about your heart health. Be well informed. This is so important. Once you know what your risk factors are and the ones that you're able to change, learn about ways how you can change them, like how Dr. Hawthorne was saying earlier, be more active, watch what you're eating. Those are the things that you really need to know. And fortunately, the Women's Heart Initiative, we have a hotline that we encourage women to take those risk modification programs that Mainline Health has to offer. But most importantly, be your own advocate.
And
ask questions.
That's a huge point. And I think Heather was alluding to some data that came out recently from the American College of Cardiology, where they surveyed patients and physicians, and only 20% or something of primary care visits were including a heart risk assessment. It's just, there's so much to do on your annual physical that a lot of people are kind of missing that opportunity. And then the survey also showed us that only 22% of primaries felt comfortable assessing a woman's risk, a woman's heart risk specifically. So there's a lot in the within the healthcare field that we don't even understand, and we definitely have to change.
Yeah, because I think historically they've looked at women after menopause as being at a greater risk, or going through in a perimenopausal age, right? Not younger women.
Right, we have to
not
back
somebody
that
who's
up.
36. No. Right.
And then a lot of 30 and 40-year-old women don't go to the doctor very often. So we've actually teamed up with our OBs, and actually the president of the American Heart Association and the president of the American College of OB said, we have to really start working together. So they put out a call to action for us to start working together and collaborating, because most women in their 30s and 40s are going for their annual GYN visit, but don't necessarily see a primary, and we're missing the opportunity.
So let's talk about mainline health. So why should a woman choose mainline health? Share with us.
Well, I think it's an amazing place to work. We have a wonderful team of cardiologists, our men too, even though we do have a large female cardiology group. But it's basically an academic center in the community. So we can offer the best care, the highest level procedures, everything that's new and fancy in the world of cardiology, but in a smaller setting. You're not just a number, you're a patient. And so I think there's a lot of care there.
And that's part of your commitment too with the Women's Initiative, isn't it?
Absolutely. And we really try to encourage women and empower women to really know their numbers, to really understand the risk for heart disease. And also we encourage them to be their own advocates, because like Dr. Hawthorne was saying, know your family history. Not that many people know their family history. It's okay to ask a physician questions, and it's okay if you don't feel that it's the right fit for you to move on and get a second opinion. So that's what we're really trying to encourage women to do.
And so as everyone's listening to this and learning so much information, and then maybe having a lot of questions themselves, and perhaps being interested in connecting with a doc, so what should they do next?
So I think our website is listed. There's a lot of information there. The guidebook that Heather was alluding to that goes through all the different things that women should think about. The risk tool is on the website. So there's a lot of information on our website, and then they can always contact one of us for more information.
Okay. All right. So what's been very interesting, and again, in the course of a webinar, individuals are at home and they're listening and they're watching and they have questions. So I'd like to ask a couple of viewer questions, if I may. So I got this one, and it says, how can you tell extreme heartburn and chest pains as symptoms of a heart attack? How do you discern?
Well, you heard Kia's story, right? She kept saying the word heartburn, and in my mind, I'm thinking chest pain, chest pain. So it's the company it keeps. You know, heartburn that happens with associated shortness of breath. Heartburn that happens when you climb a flight of stairs. That's not heartburn.
That extreme fatigue.
Right, that extreme fatigue, which is another really great point. So the company it keeps is something that's really important. You know, is it just after you eat a big burrito, or are you getting it at all times of day? So there's a lot of clues, and I'd say if you're having extreme heartburn, really that's something you should talk with your doctor about to see if we've got to explore more.
Yeah, because you didn't have deep chest pressure, did you?
Towards the end, when I went back for my second ER visit.
Okay.
Initially, it was just the chest pain and the heartburn. But when I went for the second ER visit is when I couldn't take the pain. It got worse and worse.
Okay. So also high blood pressure. Now that's something that a lot of women seem to be dealing with. I'm not exactly sure. I guess maybe it's our stress-filled lives, and because we're sedentary and all of that. So how do you get your blood pressure evaluated? That's another question from a viewer. And how do you get it down?
So the first thing on how to evaluate it, there's of course a proper way to take a blood pressure, sitting, resting, both feet on the ground, arm on a table or being held, and a nice manual blood pressure should always be checked on both arms, at least on the first visit. And so if there's a concern, you can always check it at the grocery store, and if the machine tells you something's wrong, always go back to your doctor for further assessment. And then what can we do about it? Well, there is a lot we can do about it. So my patients who tell me they don't take medicines anymore, I'm like, well, then I've got some other prescriptions for you, because you can really decrease your blood pressure by living a healthy lifestyle. So if you exercise regularly, shooting for that 150 minutes a week, you can drop your blood pressure by up to 10 points. 10 points, that's better than medicine, right? Limiting your salt, so minimizing your sodium intake, that's another 4 or 5 points. Eating a healthy diet, and again, that's the fresh vegetables, fruits, lean proteins, whole grains. That's another 5 to 10 points. So there's really a lot we can do. If you are overweight, for each kilogram, 2.2 pounds you lose, you can expect a 1 point drop in your blood pressure, and then not drinking too much can also decrease.
Okay, not drinking too much alcohol.
Yes,
Yeah,
the alcohol, you gotta be careful.
And how critical is hydration if you have, where you're drinking water?
So everybody's
Not
different.
necessarily beer.
So yes. So water encouraged, beer be careful. Making sure you're hydrated is of course important, especially if you're on blood pressure medicines, because if you're not hydrated, you can get dizzy, lightheaded, things like that.
Okay, so we have one more question here. Other than routine doctor's appointments, what can I do to keep my heart healthy at a young age? What are your thoughts?
So again, hopefully we've kind of gone through that a little bit, but there's a lot you can do to improve your heart health. And one of the biggest ones is get out there, get moving, go for a walk, keep yourself active. Look at what you're doing with your diet, make some changes, start those changes early, because not only will you have a lifetime to show the benefit, but the earlier you start, the more likely you are to keep up with it. Work with your children to start healthy eating habits, even through childhood, although 2-year-olds are not very easy to get to eat the healthiest food. But there's a whole lot we can do. And then, knowing the things that you can control and the things you can't. So making sure you're aware of your family history that you can't control, but at least you can make sure that your doctor knows those to help think about your risk.
Okay, so any other final thoughts from you, Heather, from the
just know your
Women's Heart
risk.
Initiative?
Please take the risk assessment and as Dr. Hawthorne said, keep moving and kind of look for risk modification programs if you need help.
Okay, and
I have one.
Yes, please.
Nobody knows your body better than you.
Great.
So I think I'm here today because I was calling second, third, fourth, fifth opinions. So if you're not getting the answer you need, look at her, right? That's a good one.
So cute.
I'm crying.
Just keep looking until you're comfortable with the answer you're being told. Because
Yeah. Okay. So that's good. And like you said, be your own advocate, and you know your own body. And what a beautiful little girl. We wish her,
Thank you.
wonderful, and you a really wonderful, healthy life. Thanks so much. I'm crying.
It's fine. She usually does too.
I did good.
All right, so thank you so much, Dr. Hawthorne, Heather Forgione, and Zakiya Morrison, and Zakiya's little girl. Thank you so much for joining us. I'm Pat Shiraki, and thank you also to the Lankenau Heart Institute. If you missed anything in our webinar, or you want to rewatch any part of this video will be archived at nbc10.com/healthyu. You can also reach out to Lankenau Heart Institute for more information, or you can schedule an appointment. Their contact information is on your screen under resources. Remember to check back on nbc10.com/healthyu for future information and for future webinars. And as I said, I'm Pat Shiraki. Thanks for joining us.